We're talking about enhanced physician leadership and physician engagement. Thank you for being here today. My name is Dr. Elsie Coe. I'm the CMO of American Endovascular and Amputation Prevention, as well as the CEO and founder of Lead Physician Online Leadership Program. We're talking about two-volume book that Carson Dye has written. Before we get there, I want to invite you. If you're a physician and you're interested in leadership training, come and listen to this free webinar we have right after this at 11 o'clock. If you go to this link and register, and if you can't make it, it's okay. You can pay a small fee and you can watch the replay. And we're talking about the ability to sell as a trait and a skill that physicians need to complement their clinical expertise to really make a difference in being able to influence within their organization and their businesses. So without further ado, I'm going to introduce to you Carson Dye. Hi, Carson.
Good day. How are
Thank,
you?
thank you so much for being here. I'm going to
Fun,
introduce you.
fun.
Carson is the president and CEO of Exceptional Leadership LLC. He's a seasoned executive recruiter and leadership consultant with over 40 years of leadership and management experience. He's had experience over 2 decades of physician leadership development, physician engagement, and physician leadership coaching. So I was very, very interested in him. He's written 2-volume books, and we're going to show them, but they're called Enhanced Physician Engagement. And tell us, Carson, why did you write those books? Why this specific topic?
Well, the specific topic I'd been thinking about for several years, but when COVID hit, as I talked to several physician friends, I realized that our entire field, the all-encompassing aspect of healthcare was going to radically change. And I felt we needed more and more physician involvement and engagement in helping uh, reshape, reach, revolutionize healthcare. We can't, I'm not a physician, I'm not a clinician, and it's wrong for rooms of people with just types like me making those decisions. It's also wrong to just have a single physician, maybe the chief medical officer. Yes, a CMO can help, but we need the voices of many physicians. So, Elsie, I got so passionate about this topic. And as I talked to several other physician friends, I realized I was hitting a spark, and I actually pulled 22 physician friends in who helped contribute different chapters in this book. So this isn't just all me. This is the voice of a chorus of physician leaders and physician experts.
So yeah, let's start with the first book. I want to show everybody this book is called the first volume is called Enhanced Physician Engagement. What it is, why you need it, and where to begin. So can you tell us a little bit about what the first volume is, and then we'll go to the second.
Well, the first volume forms the foundation of enhanced physician engagement, and it looks at the issues of flourishing, positive emotion, relationships, accomplishments, ongoing involvement. And it talks about physician engagement from different viewpoints. So it's not a single dimension, it's not a survey with 10 questions. It's more broad than that. It's more strategic and long range than that. And it also speaks to some of the reasons that we need it, not just the COVID reason that I mentioned before, but if we're going to have high quality, good patient safety, if we're going to have organizations where people are not trying to escape the great
Mhm.
resignation, the more engagement we have, the better we're going to have it as patients, as a community, and as
Yes.
people looking and seeking for wellness.
Yeah, you know what? You put a rich amount of resources and the bibliography is amazing in this book. I want to just quote something on page 236. I know this is the second book, but it describes a study by Press-Ganey 2019. Responses of over 1.8 million physicians, nurses, and other healthcare workers, and the company found that physicians are the least engaged. They're the least engaged, followed by the registered nurses, and the senior managers had the highest engagement. And what is the result of that, Carson?
I think a lot of it's tied to what I call lack of line of sight. What do I mean by that? If you're sitting in the boardroom, if you're sitting in the C-suite meeting rooms, you have a clear line of sight of what's going on. But oftentimes, if you're the clinician at the bedside, you're just swimming in details and oftentimes frustrations. And it's not just the EHR.
Yeah.
It's oftentimes not knowing, why is this being done? There is not that line of sight. And moreover, as our healthcare organizations get larger and larger and larger, there's a downside to that. And you don't have as much line of sight. I started my career in a 63-bed hospital working for Sister Mary George. Trust me, we all had a clear line of sight. But as I worked in increasingly larger organizations, that line of sight was not quite as clear.
Yep, yep. And there's further data that research of I can't find that page exactly right now, but it was about how many the number of CEOs within is correlated with the outcomes who are physicians, CEO physicians,
Yes.
and we know that maybe 5% or less of CEOs in hospitals or have a physician background.
That's correct. There's two major studies, and one of the larger ones was actually done by McKinsey, highly respected consulting firm,
Mhm.
and the data clearly shows that the physician-led organizations do have higher quality scores, higher outcomes. Interestingly, the number of physician CEOs has grown slightly in the last 20 years, but it's still out of roughly 4,400 hospitals, it's around 270. Uh, not that many. I don't necessarily argue that the CEO has to be a physician. I argue that you have to have a larger number of physicians involved on an ongoing basis with the strategic and the tactical decisions that are made no matter what type of healthcare organization it is, acute care, home care, telehealth, etc.
Yeah, and I would say physician leadership is needed in, like you said, multiple areas, not just the hospitals. We're talking about outpatient, private practices, businesses, EMR systems, any kind of consulting companies that are helping other organizations. So
Correct.
thank you so much for that. So where to begin? I mean, you've got the tools and tactics for success. Tell us some of the big ones in your mind right away that we can use, that organizations, companies, businesses can be used to get physicians on board.
Number one, physician leadership development, and doing so with physicians at a younger age, not necessarily contemplating that that physician 4, 5, 6 years out of training is going to ultimately become a full-time CMO. May not happen, but recognizing that the more education and development we give about healthcare law, healthcare politics, healthcare policy, organizational behavior, leadership to physicians of that nature, the better they can understand and become partners. I think, second of all, one of the things that's always frustrated me is what I call the difference between involvement and input. For years, I've worked in healthcare organizations where we invite physicians occasionally to the table to get their input, but then we maybe pat them on the back and say, thank you, doctor, go produce some RVUs. We go back into our C suite and then we execute. And we often change things. And the physicians wonder, why did I give up 2 days at that strategic planning retreat to give my input when they don't even listen to what we
Listen.
said?
Yep.
So I think ongoing involvement, the
Ongoing. Yes.
healthcare organizations I see that are best run are ones that have multiple physicians sitting at different tables all of the time, not
Mhm.
just invited in occasionally.
I think the
I
problem is the cost. People, healthcare leaders look at the cost and say, you know what, it's better for that physician to be out there on the field and getting the RVUs.
to which
So,
I would say, and what's the cost by not involving them?
mm,
What's the cost with
it's
the
hard to see
burnout?
those. Yes.
The cost of low engagement, the cost of those physicians. We have a new trend today with venture capital firms trying to gobble up physician groups. Do we want that? I don't think so, but you have to ask yourself why. And perhaps that opportunity cost is far greater than losing a little bit of RVUs.
Right. And there's a point in your in the first volume. So the first volume The second volume, let me just show everybody, is Tools and Tactics for Success. So I love both of them, very complementary. The first volume also, you brought in, I love this, you brought in physician leaders to talk about what the problems are. And on page 175, you brought up the money issue. So it's not just about giving the physicians more money. That's not it. Yes, there is a threshold that we need to reach before, but then there's something else. Can you talk about that, Carson?
I think the threshold, quite frankly, is the whole idea of commonality. Um, yes, if you take 1,000 physicians, you're going to have 10, 15 maybe that are very mercenary. But so often the non-clinical leaders tend to equate the part with the whole or the whole with the part. It is certainly money can be an issue, but it's not 100% of the issue. It's not even 90% of the issue. There's there's the whole idea of choice. Why physicians give, if you yourself as a physician, how many additional years did you train before you were able to quote enter the workforce? By the time you entered the workforce, I'd probably worked in healthcare administration for 8 or 10 years.
Right.
And the sacrifices that you've made, and the sacrifices today, when we look at the, quite frankly, the loans that many medical students come out of, and they're years and years paying off those loans, quite frankly. So the whole idea of emotional commitment needs to be understood. Some people say, well, Carson, that's too touchy feely. You can't measure it. Yes, you can measure it. And good engagement techniques do place a measure on that.
Yes, thank you so much. And I just interviewed Will Scott last Sunday, so go watch that. It's called the Culture Fix Academy. It's all about bringing the culture and getting everyone together for the common cause. It's about the why. Why are we here?
Yes,
And I have physician friends. I see it all the time. Whether or not somebody wants to work for an organization, why they stay in an organization is not always the salary. And the whole
that's
salary
right.
bit kind of gets me too, because we talk about, oh, I hear rumors, and you've written in the books that, oh, doctors are just greedy and they just want money. And yes, there are some bad players, but in general, we went into this field, and I thank you for the support for a reason, right? We really want to help people, and
Yes,
we sacrifice a lot of time and money.
yes, yes. I agree.
And the bit about physicians, how much they contribute to the healthcare costs, and if we reduce their salaries by 20%, you're really making a 3% dent in the
Exactly.
overall expenditures, right?
Exactly. That's true.
So I think I love. I thank you for. And what about I love the chapter you wrote on healthcare. The leadership is not inborn. It's not something you gotta stop thinking about, like, oh, he's not a great leader, so let's move on to the next person. But are there characteristics about that person that we have? Maybe we should invest in that person.
And some people do have some of those natural characteristics, but those that may not can develop them. An introverted person, research clearly says that the more effective leaders have extroverted behaviors. Note that I mentioned the word behavior because I know many introverted people who have learned extroverted behaviors. But then oftentimes
I'm an
at the end,
introvert myself.
and, and oftentimes at the end of the day, that introverted person needs to kind of decompress and sit alone for an
Yes.
hour. Um, but a lot of effective leadership behaviors can be
Mhm.
learned and practiced
Yes.
and honed.
Yes.
And so it's a mistake to simply say, well, effective leaders are born, effective leaders are made. A little bit of both, a little
Yeah.
bit of both, quite frankly.
Yeah. So, how should we develop these leadership programs for physicians with an organization? What if you have a certain budget? How do you even get started, Carson?
I'm seeing an increasing number of healthcare organizations develop their own internal programs. And I'm really amazed, and this sounds self serving pitching the books, but I apologize. I know 3 CEOs who have already purchased the books and are having informal monthly dinners with small groups of younger physician leaders to talk about different chapters.
Awesome.
And one CEO called me and she said, "This is just amazing. She said, we've done 3 of them and it's already a tight-knit group. And she said, there's 18. And she said, we go to a cheap restaurant, and I bought them the books, and we're having a ball discussing them. So it doesn't have to be send them all off to an $85,000 master's degree program. Some of it could be an internally developed program. Some of it could be some one-on-one mentoring, coaching, development. Uh, if some physicians show some interest in leadership, get them involved in a small way. Maybe meet with them once a month and talk about issues. Listen to them.
Yes, so good, and I thank you for that. How can people buy this book?
Um, of course, Amazon, you can buy anything in Amazon. That's one way. Another way is to go to the American College of Healthcare Executives website, ache.org. And Health Administration Press, which is the publisher, is a part of the American College of Healthcare Executives. And ACHE members get a discount on the book. So that's a second way to buy it.
Okay, great. And how can people find out more about you, Carson, and what you do?
I've got a website, exceptional-leadership.com, and they can feel free to check out that website or send me an email. Be patient. There are times that I'm working on a chief medical officer, chief physician executive recruitment, so I may have several days where I'm jammed, but I try to be responsive to emails, certainly.
Excellent. And is there also a phone number we can share, or is that too personal?
Not a problem. 419
Okay.
And
Thank
again,
you so
probably
much.
leave a message.
Yeah. Thank you, everybody. Thank you for listening, everybody. If you like and want to support this podcast, please like or comment below. And I thank you for the support. We want physician leadership to be better in the United States for healthcare transformation. If you want to check out our website, leadphysician.org, we have a program coming January 10. And email me if you're interested in giving a talk on physician leadership. I would love to hear from you at info@drlcco.com. Again, this is so great seeing you, Carson. I want to ask you if you have any last closing words for everybody.
Closing words. If you're not a physician, but you're a healthcare leader, I'll borrow from my lean friends. Go to the Gemba, or pronounce correctly Genba, which means the actual place. Go visit a physician tomorrow where he or she is doing his or her work. Go see, ask why, and show respect. It will pay off. Do it at least once a week.
Thank you so much, Carson. Thank you for what you do and for the support. Us physicians, we physicians really, really, really thank you, and we're grateful. Thank you. And everyone have a happy Sunday. I'll see you next week.